Thank you for staying with us. Now, cancer remains the leading cause of death for children under the age of 14 all over the world. September is Childhood Cancer Awareness Month. The proclamation of Childhood Cancer Awareness Month was made to raise awareness about childhood cancer. Every year, about 280,000 children ages between 0 to 19 are diagnosed with cancer globally. In high-income countries, more than 80% of children with cancer are cured, but in many low- and middle-income countries, where the African continent falls in, the cure rate is about 20%. The impact of childhood cancer translates into years of life lost, more significant inequalities, and economic difficulties. Joining me via Zoom is Dr. Adedayo Joseph. She is clinical and radiation oncologist at NSIA Luth Cancer Center and the founder of the Doctors Cancer Foundation. Thank you for joining me on TVC Breakfast.
Hi, good morning. Thank you for having me.
Now, September is Childhood Cancer Awareness Month. Let's have an assessment first of the level of awareness, because we commemorate this month on a yearly basis. What can you say is the level of awareness so far in Nigeria?
Well, that's difficult to measure, but I can say that awareness has definitely increased and improved. And it's not even limited to Nigeria, it's globally. Years ago, people weren't talking about pediatric cancer as much, weren't paying as much attention, and weren't investing as much time and resources. So things have really changed. The World Health Organization has played a role in that. Advocacy groups have been working very hard. So you can say that it has improved, but it's difficult to really measure for certain how much improvement there has been.
Now, how has this?
And that's why we keep working.
Now, how has that improvement brought about perhaps changes in approach towards treatment of childhood cancers? Because we say it is, reports say it is 80% curable, but then we still are recording quite a number of deaths.
That is the evidence of disparity between the developed countries and the countries that are still struggling, so to speak, the lower middle income countries. So you would have 80 to 90% survival for some cancers in developed countries. But in Nigeria, we're seeing 30% survival for those same cancers. And it is a bunch of factors. It is delayed presentation. They don't come until they're in stage 4 and it's no longer curable. It is access to resources. There are only a few pediatric oncologists in the country. There's no pediatric radiation oncologist in the country. There's no cancer center committed to children in the country. So that access to care is just not there. It is also finances, funding. So patients have to pay completely out of pocket for cancer treatment in Nigeria, and many families simply cannot afford it. They go into catastrophic bankruptcy because of their hospital bills when a child is diagnosed with cancer. So there's a combination of factors. Lack of awareness is also there among the community, but also among healthcare professionals, where patients are not delayed, are not referred on time. And that combination of factors is what leads to the lower survival rates that we're seeing in our society.
Now, you talked about delayed presentation, which leads me to the next question that has to do with what is that thing that parents can see? What are the symptoms that this cancer presents that parents can see to perhaps, detect this early enough, bring their children for whatever checks is necessary at the point?
This is a very difficult question that I get asked all the time. The truth about it is that we don't want parents looking at their children and suspecting cancer. The likely thing is not cancer. It is more likely to be an infection or just a simple bruise or something else before you get to the thought of cancer. And that's why at Doctors Cancer Foundation, we focus our training energy on primary healthcare workers, community healthcare workers, and healthcare professionals. Those are the people who should detect the problem and refer a child for specialist attention. What I advise parents to do is to make sure that the person attending to their child is a qualified physician, is a pediatrician. When a child is ill, the person that should treat a child is a consultant pediatrician. And when you're not doing that, when that's not happening, that is when you're likely to miss out on something that requires more attention. And I also say, if you've been in the hospital 2 or 3 times for the same thing and it's not getting better, it's time to get another opinion. You don't keep going back to the same place for the same treatment if it is not working.
But where a situation where having to access experienced hands that will perhaps help a parent assess a child is not available, what happens?
Well, that's a very, very good point that you brought up. And once again, the truth about it is that there's no escaping it. You have to see a pediatrician. And if that means traveling across state lines to see one, that's what you should do. But it's also the reason why the Doctors Cancer Foundation created the Look Again campaign. So far, we've trained over 1,000 primary and community healthcare workers on early detection of childhood cancer. So we show them the signs and the symptoms to look for. And we're not asking them to make a diagnosis. All we want is for them to refer to a specialist center where attention can be received, where a child can have an MRI, a CT scan, more advanced tests that are not available at the primary healthcare level. So once again, there is a severe shortage of specialists in the country, but I say to any parent, you have to find the specialist. There's no escaping that. While we will continue to train primary and community healthcare workers on early detection and early referral, the bottom line is that a sick child needs a pediatrician.
Right. Now, this brings me to the issue of what are the causes of cancer in children?
So the reason why we don't talk about causes is because there is no cause that is preventable. With adults, you can tell them if you don't smoke, if you eat healthy, if you exercise regularly, if you live a fairly healthy lifestyle, you may offer yourself a level of protection from cancer. If you get vaccinated, if you get screened, you may offer yourself a level of protection. None of that works in children. There is nothing, and I really like to emphasize this a lot because parents always ask, is it something I did or didn't do? Is it the vitamins I didn't take, or is it because I smoked when I was young? There really is very little that anybody can do to prevent cancer from developing in a child. It is something that happens at the level of the genes, and it's not due to any exposure that child has had. Sometimes these cancers develop in utero. So it's not because the parent drank something or ate something. It's not because the child was exposed to anything. They're too young to have had enough environmental exposure to have caused a cancer in them. So there's really no cause that I can say this is the cause and so this is what you need to avoid. It is something that happens at the cellular level and it's just an aberration that goes out of hand.
Is there a common age for perhaps childhood cancers?
Well, when we say childhood, we mean people under the age of 18. So we say children and young adults or children and adolescents. But different cancers occur at different times. So you would say the retinoblastoma, for example, will usually be before the age of 5. If you're talking about a nasopharyngeal carcinoma, you see that in early teens. So children between the age of maybe 10 and 13 when it occurs in children. So it depends on the specific cancer you're talking about. There is a more common age group where you find those cancers. But in general, childhood cancer means children and young adults.
So from what you have said now, there are different types of cancers that occur in children. Perhaps you would like to educate people on that.
Well, the most common cancer in children is leukemia, which is cancer of the blood. And that's the most common cancer in children in Nigeria and all over the world. Other cancers that occur is retinoblastoma, which is the cancer of the retinal layer of the eye. And that usually manifests as a change in the coloration of the eye. And that's how parents often find it at the beginning. And that's one of the things we're training primary and healthcare community health workers to find. Other cancers are Wilms tumor, which is a cancer in the kidney. The medical name is nephroblastoma. You can also have a neuroblastoma, which is most common in the abdomen, but arises from nerves. Sarcomas, which are cancers of the bone, and also soft tissue as well. So the most common soft tissue sarcoma is rhabdomyosarcoma, but there are many others. There are several. You can have a hepatoblastoma, which is from the liver. Brain tumors are very common in children. Brain tumors. So there are many different types. Nowadays, we're beginning to see adolescents, I would say maybe between the ages of 12 and 16, with cancer of the colon. which is really tragic, unfortunately, but we're beginning to see more of that.
Do you think that perhaps the environment could be a contributing cause to all of these cancers we see in children?
No, unfortunately, not unfortunately, children haven't had enough time. There hasn't been enough time to be exposed to anything, any environmental insults that would be able to cause enough damage to cause cancer. They simply haven't lived enough for that to happen. When you have environmental damage, it is in adult cancers, people who are in their 50s, 60s, 40s maybe, but not at the age of a child. There just hasn't been enough time or exposure to cause cancer. Cancers that occur in children happen on the cellular level. It's something that started on the inside, not something from the outside.
Now, September being Childhood Cancer Awareness Month, talk to us what the direction of awareness is this time.
Well, the global awareness is directed to everyone: healthcare workers, community, governments, policymakers, globally. For the Dorcas Cancer Foundation, we're doing a lot of work with healthcare workers because, again, I explain to people that, and this is something we've talked about for some time now, when a child is ill, the child is ill. Children don't pretend. They don't choose to ignore their symptoms. A woman can have a tumor in her breast, and because she's so busy or, she has other worries, she ignores it. That doesn't happen in children. A sick child is a sick child. And we have found that the average parent, no matter what struggles they have, no matter what their socioeconomic status is, will take their sick child to somebody they consider to be a healthcare professional. Unfortunately, what then happens is that child gets treated for malaria and typhoid repeatedly, and they don't refer for further examination. And that's why we're focusing our energy on healthcare workers to teach when to refer a child for specialist attention.
Now, you said that about 1,000 primary healthcare workers have been trained by your foundation, but we see that, or the question should be rather, that are we looking at a pool of more workers, primary healthcare workers being trained? Because 1,000 of them may not be enough.
It definitely isn't enough. It's not something that any one individual organization can accomplish. And it's not something that can be accomplished without government participation and partnership. And so that's why we're doing everything we can to work with government and to also work with other organizations. This month, we're starting something called the Coalition Against Pediatric Cancer, CAP Cancer. And we're partnering with other organizations in Nigeria who are also working in the pediatric cancer space. And so we're going to bring about 5 or 6 organizations under the umbrella for now, but continue to expand and grow, so that we can take all these training programs into states that we don't necessarily cover. So we work more in the south of the country, but there are organizations that work in the north of the country or in the east of the country. And when we partner with them, they are able to go and execute the same programs in the regions where they cover. We can also execute their own programs in our region where we cover in the south. So that way, we have more reach if all of us come together and work together. And we will also partner with the policymakers and governing bodies to increase coverage.
Now, that's the issue where I'd like for you to hop on, talking about collaboration with government. What's the level of engagement with government? Because, like you rightly pointed, no matter what you do as an organization or any organization, no matter what they do, it is not enough if the government partnership is not included.
I always say about government that it is our duty to seek their partnership. The government has a lot of things on their plates. They have a lot of issues to address. And I think that if any official in government sits down to his desk on any normal morning, there is a long list of problems and complaints and issues that have to be addressed. And so it's not enough to just expect that they know that it's a problem and they should address it. If you want them to make your problem a priority, it is up to you to advocate for it. And so, and I tell people all the time that there is hardly anyone I have ever met with or had a conversation with who you talk to about cancer in children and who doesn't want to help. Their response is always, what can I do? Okay, so what can we do? How can we make this better? Nobody wants to hear about children dying from cancer. But the thing is, we have to be the ones to go and present the solutions to them and tell them exactly how they can make things better. So when it comes to partnering with government, I see the situation as a situation where The advocates just haven't done enough work. There are lobbying organizations in the US, for example, that do nothing other than lobbying policymakers to improve childhood cancer policies. And until we get to that point where we make it a full-time job to go to the policymakers and present our solutions to them and get their partnership, we can spend our time complaining, but they have a lot of problems to address. So for me, and the truth about it is that when we have sought government partnership, most times we have received it. And so I see it as a situation where we just have to continue to do more to get their partnership.
Health is part of government's duty. No matter how, no matter how we look at it, it is part of the responsibility of government. And so if you're talking about lobbying, what is stopping us from doing that? Because you say we are not yet at that point, and we know that a lot of children are dying from cancer. Again,
lobbying efforts require funding, they require people, they require investment of time and co. So it is about bringing interest. So it's about building interest. This is one organization doing this work. And like I said, we're forming a coalition. Maybe as a coalition, we'll be able to do more. So it's about people who are willing to put in the time, because this is thankless work. It's not as if you're being compensated for the work you're doing, or and again, people have bills to pay, they have their own problems. So finding the people who are willing to sacrifice the time to do what requires to be done is not always easy, but like I said, the more we talk about it and the more interest we generate and the more collaborations we participate in, the more effort we'll be able to put in.
So one aspect that I would like for you to touch on at this point is perhaps treatment options, especially for parents who might be watching and be wondering if there are treatment options in Nigeria that they can perhaps get as we speak.
Absolutely, there is treatment available. The first thing I would say is that the treatment for cancer is surgery, radiation, and chemotherapy. And anybody who says anything outside of that simply doesn't have the evidence to back it. So I'd like to get that out of the way, because there's a lot of confusing information out there. And it's unfortunate for me, because I see people who would benefit from treatment, but who their treatment is delayed because they've been misinformed, right? Now, the treatment is available. It's just that it's not widely available and it is expensive. That's the problem. So like I said before, families go into catastrophic bankruptcy because of a cancer diagnosis. They sell their property, they have nowhere to live, they lose their jobs, their businesses fold because they're in the hospital all the time, they're spending all the money that they have and they're not making any new money. And so it is very difficult, that journey, to see that happening. And that was one of the reasons why the foundation even started in the first place, to offer financial support. The second thing I would say about treatment is that, so for example, the center where I work, the NSI Youth Cancer Center, offers children a 50% discount on all services. So once it is a child, they only pay half of the cost of treatment. And that was something that was done once again to increase access for children who have cancer in Nigeria. So treatment is available. You just have to go to the right place. If you are not being treated by an oncologist, you've already started down the wrong road and you can't expect a good outcome. If they are offering you treatment and you decline the treatment, you can't expect a good outcome. So it's unfortunate because it's expensive and not everyone can afford it. But there's so many organizations now that are working to improve access financially and even geographically. I advise any parent who is struggling with it to contact the foundation, and we'll begin to see what pathways we can create for them.
Then one other thing that is also very important for parents is when they discover their child has cancer, perhaps there are foods they can eat, talking about what healthcare practices they can perhaps involve to also ensure that they at home take care of their children.
Thank you for this question. This is something I'm very happy to address. And this is how I tell my patients in clinic. If you drink water only for the next 30 days and you're not taking treatment, the cancer will continue to grow. The tumor will take the nutrition that it needs from your blood, whether or not you eat. It has no impact or bearing. What is important is eating and being well nourished enough to be able to cope with treatment, for the tissues to heal, from the treatment that is aggressive, the aggressive treatment they're going to receive. The idea that eating one kind of food or not eating one kind of food is going to impact cancer treatment outcome is one that I work very, very hard to quell. It has no bearing on anything, and especially in children. In children, what is important is adequate nourishment for them to be able to take treatment, for their immune system to be strong enough, for their tissues to be able to heal and recover from treatment. There is nothing food has to do with outcome beyond that.
All right.